You're sleeping badly. You feel anxious for no reason. Your periods are all over the place. You think you're just stressed, maybe getting older. But here's what's actually happening inside your body. And it started years before you'll ever be told you're approaching menopause. This is perimenopause. And most women are in it without knowing it. Perimenopause literally means around menopause. It's the transition phase, and it can last anywhere from 4 to 10 years. Most women enter it somewhere between their mid-40s and early 50s. But some women begin as early as their late 30s. Here's the key thing nobody explains properly. Estrogen doesn't just drop steadily during perimenopause. It fluctuates wildly. Some days it surges higher than normal. Some days it crashes. That roller coaster is exactly why symptoms feel so unpredictable and confusing. One week you feel fine. The next, you don't recognize yourself. The first sign most women notice is a change in their period. But the changes aren't always obvious. Cycles might get shorter, 21 days instead of 28, or longer, skipping a month entirely. Flow can become heavier, with clotting, or lighter, barely there. You might have 2 periods in 1 month, then nothing for 6 weeks. What's happening underneath? The ovaries are producing less progesterone, the hormone that regulates the cycle. Without steady progesterone, the uterine lining builds and sheds unpredictably. Your period isn't broken. It's responding to a changing hormonal environment. Now, here's where perimenopause gets complicated, and where many women get misdiagnosed. When estrogen surges and crashes repeatedly, it drags your brain chemistry with it. Serotonin, dopamine, and GABA, the chemicals that regulate mood, calm, and focus, all fluctuate in response to estrogen. This produces symptoms that look exactly like anxiety disorder, depression, ADHD, or burnout. Women are often prescribed antidepressants or anti-anxiety medication when the root cause is hormonal, not psychiatric. The symptoms include sudden onset anxiety, especially in the morning, rage or irritability that feels disproportionate, crying for no clear reason, difficulty concentrating or finding words, a feeling of dread or doom that's hard to explain. These are real neurological responses, not weakness, not losing your mind. Your brain is responding to an unstable hormonal environment. Sleep is one of the earliest and most disruptive symptoms of perimenopause, and one of the most underreported. Estrogen and progesterone both play direct roles in sleep architecture. Progesterone has a sedative effect. It helps you fall asleep and stay in deep, restorative sleep. As it drops during perimenopause, sleep becomes lighter, more fragmented, and less restorative. Night sweats, mini hot flashes during sleep, wake you at 2 or 3 a.m. even when you don't feel hot. You lie awake for an hour. You fall back asleep. You wake exhausted. Over months, this sleep debt accumulates, worsening mood, cognitive function, metabolism, and immune response. The sleep disruption isn't a side effect of perimenopause. It is perimenopause. Beyond hormones and brain chemistry, perimenopause creates measurable physical changes. Joint pain and stiffness, particularly in the hands, knees, and hips, affects up to 50% of perimenopausal women. Estrogen has an anti-inflammatory role in joint tissue. As it fluctuates, inflammation increases, bloating and digestive changes. Estrogen receptors line the gut. Hormonal fluctuations slow gut motility, causing bloating, constipation, and food sensitivities that weren't there before. Heart palpitations. Sudden awareness of your heartbeat or a racing or fluttering sensation are a direct result of estrogen's influence on the autonomic nervous system. Alarming, but usually benign during perimenopause. Weight changes, particularly around the abdomen, begin even before menopause. Insulin sensitivity decreases as estrogen fluctuates, making it easier to gain weight and harder to lose it, even with no change in diet or exercise. Here's the frustrating truth. There's no single test that definitively confirms perimenopause. A blood test measuring FSH, follicle-stimulating hormone, can indicate the ovaries are working harder than before. But because hormones fluctuate so much during perimenopause, a single test can be misleading. You can test high one week and normal the next. The most reliable indicator is a combination of age, typically 40 to 51, menstrual cycle changes lasting more than 3 months, at least 2 or 3 of the symptoms we've discussed. A detailed symptom history is often more useful than a blood test alone. If you suspect you're in perimenopause, track your cycle, track your symptoms, and bring that data to your doctor. You are not imagining it. Let's talk about what actually helps. Lifestyle changes have strong evidence behind them. Resistance training, not cardio alone, helps preserve muscle mass and bone density as hormones shift. It also improves sleep, mood, and insulin sensitivity. Protein intake becomes more important in perimenopause. Aim for adequate protein at every meal to support muscle retention. Sleep hygiene, consistent wake time, cool room, no screens an hour before bed, won't fix hormonal sleep disruption entirely, but it reduces the damage. Reducing alcohol is significant. Alcohol disrupts sleep architecture and worsens hot flashes and mood symptoms. Many women find even one drink now has effects that didn't exist 5 years ago. And then there's HRT, hormone replacement therapy. This is a full video on its own, coming next in this series. But in brief, for many women, HRT during perimenopause can be genuinely life-changing. The old fears around HRT have been substantially revised by modern research. If you're struggling, it's worth a conversation with your doctor. Perimenopause is not a warning sign. It's not something going wrong. It's a transition, one of the most complex your body will ever make. But you can only navigate it if you understand it. And now you do. If this video helped you make sense of what's been happening, share it. Forward it. Someone in your life needs to see it. Drop a comment below telling me your biggest symptom, the one that nobody connected to hormones until now. Next week, we go deep on HRT, what it is, what the research actually says, and why the conversation around it changed completely. I'll see you there.